Hello, and welcome to a day in the life as a registered nurse in the cardiovascular ICU at Vanderbilt Medical Center. I make sure I get up with enough time to be able to beat traffic. Once I am ready to go, I wave goodbye to my family and then I'm on the road. My 40-ish minute commute allows me to enjoy my morning coffee, and when I get to work, I'm ready for the day. Today, I am performing as what we call a hail ball or procedure nurse. After I participate in morning rounds on all the patients in the unit with the charge nurses, I begin checking off our procedural and emergency equipment, and I make sure that we're prepared with all that we need so that we can have a successful day. I then begin to round on our highest acuity or critically ill patients. These patients can be supported by various mechanical devices, and they can be on high doses of medication. So I am there for the nurses for whatever they might need to make sure that their patients are safe. I also participate in rounds with the providers to see if there are any planned bedside procedures, such as this bronchoscopy, or any other central or arterial line insertions. After rounding on the nursing staff, myself or the care partners will set up the empty rooms appropriately in anticipation of any transfer or OR patients. We can sometimes have up to 8 or 9 cases a day, so staying in communication with my charge nurse with the flow of the unit is key. Here they come. We receive patients directly from the operating room. These patients can undergo heart or lung transplants or any other type of open heart surgeries. I stay at the head of the bed to transfer vital sign data onto our room monitors, and simultaneously, other nurses are situating the patient safely. Then the OR team begins report, and the surgeons stay for a bit to see how their patient is doing after the surgery. I am lucky to work with such amazing people. I can count on them for anything, and they know they can count on me. We can have some intense and busy days, but those days provide so much growth and learning and make me that much more ready for the patients that will need me the next day. After a busy day, we are on our way back home. A little bit longer of a commute home today, but that just means more time to reflect on the day and prepare for tomorrow. But I love seeing the faces on my kids when we see each other. It reminds me of how everything we do is worth it. See you next shift.